Hi, Dr. Yass here. In this video, I want to talk about what a joint is and what purpose it serves. There is mass confusion that has been developed through those trying to promote the use of joint replacement to address pain issues and dysfunction, in trying to give the idea that joints provide function. If you replace the joint surfaces of, let's say, your knee or hip where you're having pain in the region, somehow not only will that resolve your pain, but it'll also provide you the ability to function. Innumerable people have told me prior to having a hip or knee replacement that the surgeon said, oh, as soon as you're done with the surgery, you're going to be able to dance within 2 weeks or play golf or tennis. This is, just from a logical perspective, baseless information. And the way you know it, and the way I am confident in saying that it is baseless from a logical perspective, is the fact that joints do not provide function. Joints provide range of motion that allow muscles to move in such a way and pull on the joints cumulatively to allow for function. Muscles create function, not joints. So this fallacy that you're going to get a joint replacement and you will then have function is literally delusional. What I want you to understand is that if you had problems and it was muscular based and you're being falsely convinced to get a surgery, what happens post-surgery? You are going to have swelling and pain. This is going to lead to a greater inability of you to weight bear and function on that leg. As a result, your muscles will weaken further. By the time you're just healing from the surgery, you will definitely have a greater level of dysfunction, not a greater level of function. This is insanity for anyone to promote this idea. So, as a result of getting this surgery, you are now farther away from where you were before the surgery in terms of returning to a functional level, because through no fault of your own, the surgery has led to an inability to weight bear, leading to greater weakness. So, the first thing you better figure out before going for that surgery, because someone convinced you or is trying to convince you it is the golden and easy path to function, you first better make sure that the pain that you're having is associated with a loss of range of motion. Meaning that if you try to move the joint, it feels like a bone is hitting another bone, stopping the normal progression of range of motion. So the only way to really identify that you are in fact bone on bone is that there must be a major loss of range of motion, and at the end point it feels like a bone's hitting another bone. Forget this nonsense, this foolish premise that x-ray is telling you something. That x-ray is simply saying there's decreased joint space. I will certainly give you that. But to say that it is bone on bone, literally zero joint space, cannot be identified through an X-ray or MRI. Only the physical presentation of bone on bone will confirm that that is the case. So, if you find that there is this major structural limitation, what that's going to do is impede the range of motion necessary for function. That would be the only time that you would warrant a joint replacement. That loss of range of motion is limiting your ability to function. But if you've got great range of motion and you still have pain with function, or in fact dysfunction, well, that's the clearest indicator it's a muscular deficit, and I don't care how many surgeries you get. And trust me, they don't care either, because they don't mind doing the original surgery and then providing revision after revision after revision after revision. That's the system. That's the way it is. But you have to be smarter than the system. You have to take responsibility for your well-being. And you have to start making decisions about what makes sense and doesn't make sense. Not what is the normal path. I do what everyone else does, even though nobody seems to get better. If you want to follow that route, okay. But if you're looking for some logical understanding how you can determine whether you need joint replacement or not, regardless of how many surgeons you go to, because remember, you're going to a surgeon to ask if you need surgery. It doesn't sound like that's the most open-ended way of determining whether this is valid or not. So, look at your range of motion. If you have a major loss and it feels like it's being impeded by a bone hitting another bone, okay, then you consider surgery. But if range of motion has nothing to do with the pain you're having with dysfunction, you have a muscular deficit, forget surgery. You need to know which muscles are not allowing you to have normal function. Strengthen those appropriate muscles with the use of progressive resistance. I'm not talking about physical therapy. I'm not talking about trainers. I'm talking about Yass. The unique ability to first differentiate which muscles are not functioning properly, and then secondly, use progressive resistance by performing isolated exercises, allowing one muscle to work against a set resistance that allows it to adapt and eventually get strong enough to where its force output is greater than the force requirements of your activities, which then allows you to be pain-free and fully functional. Hopefully this makes sense to you. Joints do not equate to function. Joints allow for range of motion. If range of motion is impeding function, then that could be a consideration. But if range of motion has nothing to do with your issue and you're just having pain with dysfunction, that's muscular. Forget the surgery, get the strengthening, get the Yass method. All right? If you like this video and it's making sense to you, give it a thumbs up. Let people know that there's validity and value to what I'm doing. If you like what's going on my YouTube channel, please subscribe to it. I'm going to keep putting these videos out. I'm going to keep putting information out there that is useful and applicable. It will allow you to be able to resolve your symptoms. If you would like to get in touch with me, you're having an issue, you want to discuss it specifically, you can contact me through my email address, drmitch@mitchellyass.com, drmitch@mitchellyass.com, drmitch@mitchellyass.com. If you would like me to assist you in confirming or not whether you need surgery or don't need surgery, or you want me to help you figure out which muscles are involved and help you do those exercises correctly and understand the idea of progressive resistance, you can set up for a Skype or a Zoom session. There's a lot of desire for this now, so we're looking at being about 4 weeks out from the point at which you request it. But we will certainly be able to get that for you and help you progress to a point of pain-free and fully functional life in the shortest period of time. You want to look towards that Skype session or Zoom session, please contact me through my email, drmitch@mitchellyass.com. All right, I hope this one helps you. I don't want to find another person getting an unnecessary surgery they didn't need. And I can tell you now, 95 to 96, 97% of these surgeries were unnecessary. More than 95% are unnecessary. You are being manipulated. Here's your chance to understand how you can decide whether that surgery is right or whether it's nonsense, and you just need a little bit of strengthening to get your life back, be fully functional, and do what you want when you want. All right, for now, Dr. Mitchell Yass, wishing you a pain-free, fully functional life. Bye-bye for now.